My name is Holly Richter, and I'm the Director of the Division of Urogynecology and Pelvic Reconstructive Surgery at the University of Alabama at Birmingham.
Hello, I'm Candace Parker-Autry, currently a Fellow in the Division of Urogynecology. We are the principal investigators for the Medical Student Education and Satisfaction in Urinary Incontinence, or MESU study, a randomized controlled trial.
Urinary incontinence is a prevalent condition that affects up to 50% of women and creates significant medical, social, and economic impact. Urinary incontinence is a visible condition associated with negative social interactions, coupled with seeing stained clothes or the smell of urine. Consequently, only a minority of women with this condition independently seek care for the evaluation and treatment of their urinary incontinence. Therefore, all physicians, especially primary care physicians, should be adequately educated about the basic etiology, diagnosis, and management options for urinary incontinence. The quality of care provided to vulnerable, older community-dwelling patients with urinary incontinence by primary care physicians has been reported to be inadequate. Additionally, urinary incontinence was a topic that primary care physicians prioritized as a topic area that further training would be desired. Thus, it is evident that more education is needed for medical professionals on urinary incontinence. Currently, medical education regarding urinary incontinence is inadequate. In fact, nationally, it was found that 89% of first-year medical students and 80% of second-year students had no exposure to topics in pelvic floor disorders, including urinary incontinence. A multi-center study on urogynecology education found that increased urogynecology knowledge was associated with the inclusion of a urogynecology subspecialty lecture. Therefore, in order to increase access to this information, innovative and more individually accessible learning options are needed.
The current trend in medical education is to incorporate non-traditional online materials that allow for easy access to education. We propose to use a two-part video series to instruct students regarding the etiology, diagnosis, and management of female urinary incontinence. The videos were constructed using the learning objectives on incontinence established by the American Urogynecologic Society and the Association for Professors of Gynecology and Obstetrics provided for third-year medical students during their OBGYN clerkship. We hypothesized that the addition of this video series will improve medical student knowledge of female urinary incontinence and will enhance their satisfaction with their clinical experience. In phase 1 of our study, we will implement an IRB-approved randomized trial to test the effectiveness of this video series as an educational intervention by comparing it to traditional methods of study. Urinary incontinence knowledge will be measured using a urinary incontinence test. Phase 2 will allow for the development of a scripted physician-patient encounter to expose medical students and trainees to an interview by a urinary incontinence expert physician to instruct them on how to elicit urinary incontinence symptoms, how to determine the type and severity of urinary incontinence, as well as how to perform the pertinent pelvic examination.
Urinary incontinence is a prevalent, underreported condition that significantly impacts the quality of life of women globally. Early emphasis during medical school with the use of innovative techniques may be needed to expand physician knowledge, resulting in improved access to quality care for incontinent women. After the completion of the study, our final product will be a web-based educational tool allowing global use by medical students and physician trainees in all specialties who seek more knowledge on female urinary incontinence.
Our broad goal is to allow students to have access to this educational tool wherever they are, whether it's at home on their personal laptop in preparation for clinical duties the next day, or whether it's here in the hospital in preparation to care for inpatients with urinary incontinence. They will also have access to the educational tool on their smartphone as well as their tablet PCs in preparation for the operating room or clinic experiences.